Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about metabolic syndrome. So metabolic syndrome, formerly known as syndrome X, is a constellation of symptoms of which if you have them, you have a greatly increased risk of having diabetes, heart disease, stroke, and premature death. So there's 5 components to metabolic syndrome. If you have 3 of the 5, you're considered to have metabolic syndrome. First is a elevated blood sugar, a fasting sugar greater than 100, or if you've already been diagnosed as having diabetes. Number 2 is if you have hypertension or high blood pressure. Number 3 is elevated blood triglycerides greater than 150. Number 4 is a HDL good cholesterol less than 40. And 5 is if you have an abdominal circumference for a woman greater than 35 inches or for a man greater than 40 inches. And for the men, your abdominal circumference is not the same as your pant size. So if you've got a 32 pant and a 50-inch belly hanging over the top, that's part of metabolic syndrome. So metabolic syndrome was originally described, and we knew this probably 75 years ago, that if you were apple-shaped or pear-shaped. So women generally are pear-shaped. They have most of their fat on their hips and their legs, and they're shaped like a pear. Men are generally apple-shaped. They carry most of their fat in their abdomen or midsection. I'm sure you can picture the truck driver with his shirt off. He's got a 55-inch belly. He's got skinny arms and legs, and you can't actually even pinch an inch of fat on his abdomen because all of the fat is actually inside of his belly behind the abdominal muscles. That's what we're describing in metabolic syndrome, or being apple-shaped. So if you have this condition, what we know is happening is that the abdominal fat, or the fat around your intestines, is actually metabolically active. Think of it as a gland like your thyroid gland, which actually produces hormones or chemicals. Unfortunately, the abdominal fat, the chemicals that are produced, are all bad for you. They create inflammation, they make you insulin resistant, they raise your blood pressure, they do all kinds of bad things. So if you looked at someone and their thyroid gland was hanging over the top of their shirt, you'd say, oh my God, that person obviously has thyroid disease. Look how big their thyroid gland is. If you think of belly fat as the same thing, and you see someone with their belly hanging out over their pants, that's the same thing. It's an enlarged organ, and unfortunately it's a evil organ. It's not a happy organ, and it does only bad things. So remember the 5 things, and you'll have to pull out your lab test from the last time you went to the doctor to get all of the numbers, but a triglyceride greater than 150, a HDL cholesterol less than 40, elevated blood pressure or hypertension, a sugar greater than 100, or if you're already diabetic, and for a man, an abdominal circumference greater than 40 inches, and for a woman, greater than 35 inches. Unfortunately, if you're Asian, those numbers are 35 inches for a man and 30 inches for a woman, because Asians generally are smaller framed people, and they actually have a much higher incidence of heart disease and diabetes, so they have a lower parameter before they're called metabolic syndrome. So any of the 3 of the 5 considers you to be metabolic syndrome. The good news is that medications treat your diabetes, medications treat your blood pressure, medications can treat your cholesterol, but the ultimate goal in metabolic syndrome is to get rid of the abdominal fat. If you had a giant goiter or thyroid, we'd want to get rid of the goiter to solve the problem. So losing weight from the midsection, hard to do, but if you lose weight and your abdominal circumference gets smaller, then your organ gets smaller, and the amount of inflammatory and harmful chemicals that it makes also lowers, and we actually see these conditions getting better. What I see in the office, usually the first thing that we'll see as a hint of metabolic syndrome, even if you haven't made 3 of 5 yet, is an elevated triglyceride. So less than 150 is normal. When we start seeing 180s and 200s, that's definitely not normal, and probably we're going to look towards metabolic syndrome. If you don't have it, we're going to recommend weight loss and decreasing carbohydrates in your diet. Metabolic syndrome, I've got it listed below, the 3 of the 5. You can look at that and circle how many you have, and those numbers are absolutely in flux. You can change them and improve them with lifestyle and diet changes. Dr. Greg Castello, thanks.